Rushanara.
Secretary of State for his answer, but the reality is a decade of underinvestment and mismanagement has meant 4.5 million people are on waiting lists and over 100,000 people shortages of staff before we even entered the pandemic. That exacerbated health inequalities. And while I welcome his announcement about the work that his department's doing, the reality is if you live in a constituency like mine, you're twice as likely to end up on waiting lists for over a year for treatment than those in better off areas. So while I welcome what he's announced today, can I ask that he puts in appropriate investment to go along with tackling these appalling health inequalities?
Secretary of State.
Mr. Speaker, I think the Honourable Lady is absolutely right to talk about the importance of tackling health inequalities, and I think on that we absolutely agree, and I hope she will help contribute to the health disparities white paper I mentioned a moment ago. But I do think it's wrong of her to suggest that some of the current challenges we face is because of underinvestment or a smaller workforce than otherwise. We have the largest investment ever going into the NHS. Its budget this year is bigger than the GDP of Greece. It's the highest amount ever, rising by billions each year. We have more going to social care as well than ever before, and we have the highest level of workforce the NHS has ever seen in its history.